Hey there everyone, welcome back to the channel. Today, we're tackling a topic that affects a lot of guys but often gets swept under the rug: gynecomastia. Picture this: feeling constantly self-conscious about your chest, always fidgeting with your shirt, or avoiding social situations out of embarrassment. For many men, this is the reality of gynecomastia, a condition where breast tissue grows in males. It can range from a subtle swelling to a more noticeable bump, seriously affecting a guy's confidence and how he feels about his body. While it's pretty common, a lot of men feel alone and unsure about what to do. They might not know that surgery can be a real game changer, helping them address this issue and feel more confident in their own skin. Let's talk about it. In this video, we're going to lift the lid on gynecomastia surgery, clearing up the myths and giving you the info you need to make smart choices about your health and happiness. We'll dive deep into what gynecomastia is, explore its causes, and see how it can really affect a guy's life. We'll break down the surgery itself, from the different techniques to the recovery process and potential risks. And we won't sugarcoat it. We'll talk about cases where things didn't go as planned. Our goal is to empower you with knowledge so you can prioritize your health and make decisions that fit your goals. So let's break down what gynecomastia really is. It's when guys develop breast tissue. This tissue, like in women, is made of glands, fat, and connective tissue. When there's too much of this stuff, it can cause the noticeable swelling or enlargement you often see. The main reason for gynecomastia is a hormonal imbalance, with too much estrogen compared to testosterone. This balance is super important for a guy's development and function, and it can get messed up by different things. Here are some of the most common triggers. Puberty. A lot of boys get a temporary case of gynecomastia during puberty as their bodies deal with all the hormonal changes. It's usually normal and goes away on its own. Medications. Some medicines, like those for heart problems, HIV, and anxiety, can have hormonal side effects that lead to gynecomastia. Steroid use. Using steroids, whether for sports or other reasons, can really mess up your hormones and make you more likely to get gynecomastia. Medical conditions. Problems like liver or kidney disease, thyroid issues, and certain tumors can affect your hormones and cause gynecomastia. Aging. As guys get older, their testosterone levels naturally drop, leading to more estrogen. This can make them more likely to get gynecomastia as they age. You might be shocked to know just how common gynecomastia really is. It's thought that up to 50% of guys will experience it at some point in their lives. This shows how widespread it is and means you're not alone if you're dealing with it. While many cases clear up on their own, others stick around and can really mess with a guy's life. Gynecomastia can lead to a bunch of problems that go beyond just the physical. Body image issues. Feeling bad about your chest can seriously affect your self-esteem, confidence, and how you interact with others. It might make you avoid things like swimming, going shirtless, or even getting close to people. Emotional trouble. Feeling embarrassed, anxious, or even depressed is common for guys with gynecomastia. These feelings can really impact your mental health and overall well-being. Physical discomfort. Sometimes the enlarged breast tissue can hurt or be tender, especially when you exercise or do physical stuff. This can make it hard to enjoy things you used to love doing. Social awkwardness. Gynecomastia can make guys feel uncomfortable getting undressed in public or doing things where their chest might be seen. This can lead to feeling isolated and avoiding certain activities. For many guys, gynecomastia surgery can be a real game changer. The main goal is to get rid of excess breast tissue and give the chest a more masculine look. This not only makes you feel better about your body, but can also boost your confidence, helping you feel comfortable and accept yourself. There are two main ways to do gynecomastia surgery. Liposuction. When most of the excess tissue is fat, Liposuction can be used to gently remove it through small cuts. This is a less invasive option for guys with milder cases of gynecomastia. Excision. When there's a lot of glandular tissue, excision involves surgically removing the excess tissue and sometimes extra skin. This is usually done through cuts placed in strategic spots, depending on each person's body and how bad the gynecomastia is. The surgery is usually done under general anesthesia and takes a few hours. After the surgery, patients need to wear a compression garment for a few weeks to reduce swelling and help healing. Recovery time varies, but most guys can go back to work and do light stuff within a week or two. However, they should avoid intense activities for a few weeks to let their body heal properly and reduce the risk of problems. Before we learn about the risks and side effects, don't forget to hit the subscribe button along with that bell icon so that you won't miss any exciting updates from the channel. Like any surgery, gynecomastia surgery has some risks and potential side effects. It's important to know about these before making a decision. Understanding these risks can help you make a choice that's both informed and fits your comfort level. Some of the more common risks and side effects include infection. There's a risk of infection at the places where they make the cuts, like with any surgery. Good hygiene and following post-surgery instructions can help reduce this risk. Bleeding. While not very common, there's a chance of excessive bleeding during or after the surgery. Surgeons take steps to minimize this risk, and there are plans in place to manage bleeding if it happens. Scarring. The cuts made during the surgery will definitely leave some scars. However, these scars usually fade over time and can be minimized with good surgical techniques and aftercare. Asymmetry. It can be tough to get perfectly symmetrical results. There might be some asymmetry, but skilled surgeons try to make any differences as small as possible. Nerve damage. In rare cases, nerves near the cuts can be damaged, which might lead to temporary or permanent numbness or tingling. This is less common with experienced surgeons who know the chest area well. Fluid accumulation. Swelling and fluid buildup are normal after surgery. In rare cases, this can lead to seroma, fluid collection, which might need to be drained. Fat necrosis. When liposuction is used, some fat cells might die, potentially causing lumps or unevenness in the treated area. While complications aren't very common, it's important to remember that they can happen. Knowing about the possibility of complications can help you prepare for different scenarios and have open conversations with your surgeon. Some cases where things might not go as planned include unsatisfactory aesthetic results. The surgery might not look the way you wanted, leading to dissatisfaction with your chest appearance. Uneven healing. Scars can be uneven, causing asymmetry or visible bumps. This can sometimes be fixed with another surgery. Persistent pain or discomfort. Some guys might still feel pain or discomfort in their chest after surgery. This is usually temporary, but in rare cases, it can be more long-lasting. Revision surgery. In some situations, another surgery might be needed to fix problems like asymmetry, uneven scars, or unsatisfactory results. It's important to understand that the success of gynecomastia surgery depends on several factors, including each person's unique body, the surgeon's experience and skill, and the patient's following of post-surgery instructions. Choosing a qualified and experienced plastic surgeon who specializes in gynecomastia surgery is absolutely crucial for getting the best results and minimizing the risk of complications. Before getting any surgery, it's really important to do your research and carefully choose a surgeon. Taking the time to find the right surgeon can make a big difference in how successful your procedure is and your overall experience. Here are some key things to consider. Experience and qualifications. Look for a board-certified plastic surgeon with a proven track record in gynecomastia surgery. Experience is crucial for getting the best results. Consultations. Schedule consultations with different surgeons to discuss your specific needs and expectations. This lets you compare their approaches, philosophies, and surgical techniques. It's also a good chance to see if you feel comfortable with each surgeon. Before and after photos. Ask to see the surgeon's portfolio of before and after photos of their previous patients. This gives you a visual idea of their typical results and helps you see if their aesthetic matches your own preferences. Communication and comfort. Choose a surgeon who you feel comfortable talking to openly and who takes the time to answer all your questions and concerns. Open communication is essential for building trust and ensuring your needs are met. Hospital facility accreditation. Make sure the surgical facility where the procedure will be performed is accredited and follows high safety standards. This ensures you're receiving care in a safe and reputable environment. It's also important to have realistic expectations about the outcomes of the surgery. Open and honest communication with your chosen surgeon is key. Be sure to discuss your concerns, goals, and any potential risks you might have. This open dialogue helps you manage your expectations and prepare for different scenarios. Gynecomastia surgery can be a life-changing experience for many guys, boosting confidence, improving body image, and enhancing overall well-being. However, it's crucial to fully understand the procedure, including its potential risks and benefits. By educating yourself, choosing a qualified and experienced surgeon, and managing your expectations, you can make a smart decision that fits your individual needs and goals. If you have any questions about gynecomastia or are considering surgery, please feel free to leave a comment below. We're here to support you on your journey towards a healthier, more confident you. Before you leave, don't forget to give this video a thumbs up.